what types of foot products can you use as a diabetic? You are probably taught to read the labels and to check for use. And if you're doing that as a diabetic, you're probably noticing that the majority of foot products out there say, if diabetic, consult your doctor before using. So I'm going to give you a little bit of advice on some of those foot products that are safe for you to use and what alternatives that you have for those products that maybe aren't really a good idea. Now, first, let's talk about moisturizer, because this is actually extremely important for diabetics. Diabetes causes dryness in your skin that can make your feet extra dry and cause callousing or fissures, which are cracks inside the skin that can lead to infections. So it's very important to use a routine moisturizer. Now, the vast majority of moisturizers out there are very safe for you. There are some specific moisturizers that are formulated for diabetics. Typically what this means is that they have a higher content of different ingredients that actually increase the amount of moisturizing tools inside the medication. So if you have questions about a specific brand, you can talk to your doctor, but you should all be using a daily moisturizer on your skin. So the next thing I want to talk about is pedicures. A lot of people ask whether or not that they can have a pedicure as a diabetic. And the golden rule is no, you really shouldn't, because in general, you shouldn't be using anything sharp on your feet. And you have to be very careful when trimming your toenails or filing down calluses. Now, it's very easy to accidentally cut yourself, or it's very easy for somebody else to accidentally cut you. Now, the concern we have with pedicures is that you're very prone to having infections in these environments. Oftentimes, the tools that they're using, especially what they use to remove calluses, may not actually be sterile or sanitized in between their clients. Also, the foot baths that you use during that time where you're soaking your feet, it's not always a guarantee that they properly cleaned out the tubs where you're soaking your feet. So you could easily get cross-contamination or an infection from a pedicure salon. There are some salons out there that are absolutely fabulous and cater to high-risk populations, which I would encourage you to use if that is something you're interested in and you're relatively low risk. Now, can you use nail polish? So maybe you still want to have pretty feet, and maybe you can ask your granddaughter or your children to help you out here if you're having difficulty reaching your feet. But absolutely, it's safe for you to use nail polish and those types of products on the nails themselves. My rule with nail polish is try not to keep it on for more than 3 weeks before you remove it and exchange it out. It can help prevent you from getting a fungal infection or other things damaging the nail. Now, third, let's just talk about shoes in general. Now, shoes don't usually come with a warning label, but sometimes they really should. You have to make really smart decisions about what kind of shoes you're wearing on your feet. You do not want to wear something that's going to form a blister, too much rubbing, or callousing. If you're noticing skin irritation after wearing a particular shoe, you really need to retire that shoe and make sure that you're wearing properly fitted shoes. Secondly, let's talk about socks. Now, there is actually diabetic socks. You may have seen these advertised, they may have been suggested for you, and they're wonderful. Diabetic socks are just designed to have a certain fiber contact that can help decrease some of that moisture difficulty that you have in your skin, but more importantly, they're oftentimes seamless, meaning that inside of the sock there is no seam. So that decreases the risk of having that uncomfortable seam rubbing up against your toe that can create a blister or a sore. The elasticity inside the sock is actually really good. That can provide a little bit of compression without that whole cutting off of circulation type thing that we sometimes see at the end of the day when we take our socks off. So things that I think all diabetics should use are diabetic socks and daily moisturizer. Things that I think all diabetics should overly avoid is anything that is sharp and pedicure salons, unfortunately. Now, what about Epsom salts or daily soaking your feet at home? Because maybe you want to have that at-home spa experience. And this is what I consider a little debatable. In general, we typically discourage diabetics from soaking their feet. The reason we do is because of peripheral neuropathy, or the disease of the nerves in the feet, can actually change our ability to sense temperature appropriately. So I think every podiatrist has seen a patient who has scalded their feet or accidentally burned their feet in too hot of water. So we've just say don't soak your feet because we're with the fear that somebody will injure themselves. Now, if you are careful and you're testing that water with your elbow or a thermometer and you're making sure that it's not too hot, I am okay with you soaking your feet for about 15 minutes. We really don't want to or need to soak our feet for any prolonged time after 15 minutes. You can use Epsom salts and different types of things inside the water. Those are typically safe. We always want to make sure that we thoroughly dry our feet afterwards. And most importantly, no matter what products you are using, even if you're breaking my rules, I want you to be doing daily foot checks. Just look at your feet or have a family member look at your feet. If you can't see the bottom of your feet, get yourself a mirror that you can put on the floor and stare at and take a glance, because we want to catch problems before they happen. I'd much rather see you in the office for prevention rather than a reaction to an injury. So if you have any additional questions, make sure you visit our website or call our office. We're always happy to serve our diabetic population.